Hi, everybody. Good morning or good afternoon, depending on what time you are watching this. My name is Joanna Cirillo. I'm the Clinical Practice Program Manager here at CHS, so I work under Kendra Jackson. I'm the Director of Public Health Nursing. So what I am here to talk to you about is a new initiative that we are starting here in 2025, nurse chart reviews, peer chart reviews. So I know that some districts are already doing this, but for a lot of nurses and a lot of districts, this is going to be new. So we have a PowerPoint and these slides that I will go through, the reasoning why, all of the how-tos, and we'll also go through the tool itself. And then everything will be posted to the intranet. So please, after you watch this, if you have additional questions, do not hesitate to reach out to me. So starting with the why are we doing this? It's a really common practice in different areas of nursing and in the clinical space. And we looked into the safety event reports that were reported to us in 2024 and found that 40% of them were preventable. So things like we gave the wrong vaccine or the wrong vaccine timing. So clinical practice related. And the goal of this is to increase the quality of care that we're providing, definitely to decrease the risk of safety events and also improve the communication between staff, but basically just to make sure we're doing really the best quality work that we can do. And this is something that already exists for the nurse practitioners, so we're really extending it now to the whole public health nursing workforce. So this is a list of a bunch of different resources. After you watch this, you can go to the General Nursing Resources button on the nursing intranet page. It's sort of the top left. You'll find this PDF of the PowerPoint, the actual tool itself. It's a that you can use. A link to the red cap where you'll fill out your summary and this recording. So all that stuff will be on the nursing intranet page for you. Okay, so let's dive in a little bit to the process. So there are 3 distinct steps. The first step starts with you. You'll be paired with a buddy. You'll find a peer. And each quarter, we'll ask that you look at 10 of your buddies' charts. We have instructions. We have a tool that we'll look at. You are not left on your own with no instructions. So you'll look at 10 charts each quarter. You'll fill out at the end of that just a summary on REDCap, what went well, what could use some improvements, and you'll hit submit. That summary will then go to the nurses' supervisors so they have awareness. And if they need any sort of extra assistance or an improvement, the supervisor will be able to go through that with them. Then at the very end, the nurse managers have access to all of the reports. So how many chart reviews and summaries were submitted, what's a little bit of like a collation of the data, what's going on with the district. So they'll sort of have the bird's eye view of that information. And I'm really going to go through each step and show you what it looks like. Okay, so that first one, like I said, we're asking to complete a quarterly review of 10 charts. So between the months of January, February, and March, for example, look at 10 charts that were documented in that period. We would recommend like a peer-to-peer, so nurse senior to nurse senior, PHN to PHN, that kind of setup, but that's just recommended if it makes more sense per program. So TB nurse looks at a TB nurse charts. That is, of course, up to you. So you'll see the tool that we have made for you to complete based on the primary program for which the nurse works. So if you're really 99% of the time an immunization nurse, you can just pull up the immunization chart review tool and you just can use that. If a nurse really works across all the programs, you can do a sample. And I know there's some nurses that might document on fewer than 10 charts. So just do your best. Like if it's a TB nurse and you're really just focusing on your 4 active cases, of course, just review those 4. And the reports and the summaries are due in REDCap by the 15th day. So March 31st, June 30th, September, and December 31st, it would be the 15th day of the following quarter. Okay, so this is actually what the tool looks like, and I'll pull it up for you in a second. So it's looking for a few different aspects of the chart. Completeness. You can see it's broken up by chunks, were all of the forms in the chart that needed to be there. Accuracy, were all of the fields filled out that are necessary? Did you sign your name? Did you write the dose? Are all of the necessary fields completed? Clarity, can we read what you wrote? Are there sticky notes where it should really be something written in the chart? Things like that. And timeliness, did you document in a reasonable amount of time after the event occurred? So you'll see a bunch of little letters here, and all of this is in the instructions I'll show you. But basically, it's pretty simple. You're going to put a C for complete. So this example is the immunization chart review tool. So we'll do one, was the most up-to-date encounter form used. If you look and it's the most up-to-date encounter form, you put a C. If it's an old encounter form, something's out of date, I would put incomplete, a letter I. If something was completely not done, like, let me see here. Okay, the bottom, lot number and site documented. So if I completely missed the documentation, I did not write down the lot number, I only wrote the site, I would put an I for incomplete. So it was indicated and the documentation was partially complete. If I did not write down my lot number and I did not even document the site, I would put an ND for not done. It was not done. I don't even get partial credit. If something on here is not relevant, which you'll see, some things are only going to be relevant to certain clients, you can put an NA. So that was just not applicable. So again, you're just going to be writing little letters in here. So C if it's complete, I if partial complete, partial credit, ND, you just missed it, it was not done, or an NA if it's not applicable. Okay, so you can see on here too at the top where it says Web Vision ID, each form, so I have one of these for immunization, family planning, STI, TB, and newcomer health, has space for 5 different charts within the same PDF. So if you look at the top, the 9 numbers, these are my fake Web Vision IDs. So just on this one sheet, I'm looking at 5 different charts. So the date of service, the Web Vision ID, and then if you go straight down the column, that's all of the actual indicated fields based on best practice, based on our policies that should be in the chart. So if you're doing 10 immunization charts, you would just have 2 PDFs. And after we go through this PowerPoint, I will pull up the instructions as well, so you can see a little bit more of what these look like. But for the sake of time, just to continue, so say I looked at all 10 of Tom Jones's immunization charts and I've filled out my PDF and I saved it. The next step, I would click on the red cap link at the bottom and I'm going to fill in this summary. So it's really quick, I promise you. It's not painful. You're going to put your name, so Joanna Cirillo. I would put today, and then the nurse being reviewed, I would put Tom Jones. And then I'm going to put the email of Tom's supervisor so that they get this summary. So I would write santasupervisor@vdh.virginia.gov. The health department I'm reporting for, I would click and find it. And then I'm going to upload that PDF that I saved. If you are not comfortable with fillable PDFs, you can always print it out. You can handwrite it and save it. But we ask that you upload the copy so that the supervisor can really see all of that information if they need to. And again, we'll go through this live. And then the summary. What did you find? Tom Jones did a really great job at making sure, he signed in all the places he needed to sign. And then the next question, were there deficiencies noted during this quarterly review? So if so, hit yes and say, Tom forgot to offer this client a flu shot, or Tom, forgot to sign his name. He forgot to write the lot number, whatever it was. You can hit yes and write that in there. So this is once all 10 are done, you've put your charts away back in the medical room, medical records, and you open this up and fill it out at the very end of your quarterly review. So that's the first step. That's everything in the peer chart review. You get 10 charts, you fill it out, the PDF, and you submit a summary in REDCap. The next step is that supervisor summary. So once you click send, Tom Jones's supervisor gets an email. They pull it up and this is what they see. So they see at the top the nurse that's being reviewed, the date, who completed it, so that would be me, and whatever summary you wrote in the file gets sort of piped over to the supervisor. So supervisor gets to see Sandy did a great job. Deficiencies, she gave one wrong vaccine, and then the link here is your file that you uploaded. So the supervisor sees all that, and then at the bottom they complete their portion. So I would write my name as the supervisor, and then based on this information, is there a need for some sort of corrective action plan? Yes or no? They write that down, and then if applicable, the date that they discussed with the nurse, and then they hit submit. So supervisors do not need a REDCap account. They just click the link that comes to their email, but they can download a PDF copy at the end of this so that they can have a copy for files, whatever they need to do. All right, so that's it. And then the supervisor is done. They have visibility on sort of the quality of the chart review and all that stuff. Now we're at the third part. So nurse managers will be given REDCap accounts so they can see everything. And I'll pull up REDCap in a second so you can all see what the nurse managers will be able to see as well. Okay, so for all of this, the timeline that we're hoping, so by April 1st, all of this will be on the intranet. You'll have all the information you need and we will begin to communicate it. The first 3 months, April, May, and June, will sort of just be a pilot. You can talk about this process with your staff. You can go through, you can start to use it, just basically a trial period, play around, and get to know it, establish local workflows. Like, how are you actually going to pair people up? How are you going to find the charts? That kind of thing. Starting July 15th is when we will really get started. So all chart review summaries should be documented for that previous quarter. So July 15th, we should actually have some real information in here for encounters from April, May, and June. So April, May, and June, you can sort of start to play around with this, but then by July 15th, we have some actual information in here. July 22nd, so a little bit later, we welcome feedback at the nurse managers meeting. Please, the good, bad, and the ugly, of course, we would be open to that. And then we incorporate it into the tool. And then October 15th and January 15th, we're rolling. We're doing this. We're figuring it out. So that's our timeline. Just a couple of things. We started with sort of the major programs, but we do not have this yet for LTSS, maternity, or baby care. So hopefully we can have those tools and instructions added for those programs by this summer. And if you're the nurse manager and you don't really have an exact peer, we'll figure that out for you. Okay, so let me shift gears here. Woo. Okay. So